Hello and welcome. This is Mike Decker. I'm presenting a COVID-19 world update. I've decided to do this because I'm not very satisfied with the analysis that I'm seeing in the media. I'll give a shout out to Dr. John Campbell out of the UK. He does a really good presentation. And that's probably the closest thing I have found to something that's useful to me as somebody who, by experience, is data driven. I wanted to just make that introduction here. I'm not a doctor. I'm an engineer in immunodiagnostics industry. I work with data a lot. I've been trained quite heavily in Kaizen, Six Sigma, disciplines that deal with data at a deep level. All of the content, all the verbiage that I state in this video is my opinion, and you can take it for what it's worth. Hopefully I'm going to give you something that helps you to understand what's going on, and at the same time, I think it will be helping me to have a better view of what's going on in the world. This is the first edition, so obviously there's going to be bugs and kinks. Hopefully it'll get better as I go. Please feel free to leave notes in the comments if there's something you would like to see. I do have a general format that I'm trying to work towards, but if there's something you would like to see for the future, I'd love to see it in the comments because I think together we do a better job of getting the answers that are necessary to understand what's happening in the world. So I'd like to start off taking a look at the numbers in the US. If you look at the way this chart is set up, there's only 30 data points on this chart. And the reason why I like to see 30 data points is that it gives us enough data points to be statistically valid, essentially. But then at the same time, it isn't so much data that we're hiding what's currently going on. So this is from Our World in Data. It's a great website. I highly recommend you go there and look at what they've got. If I were to give it a diss, I wish that they would drill down to state level, province level. Instead, they just deal with country level data. So that would be a help. There's, as you can see, it looks like we have an upward trend in the US. This data is number of cases per million people in the US, and that's daily new cases. So these are the cases that are reported and confirmed on a daily basis from May 22nd to June 20th, and each one of those dots is a day. You can see on it that there's a little bit of a, wavy, rolly pattern to it, and my gut tells me that there's something going on a weekly basis. Probably the weekends are affecting the data a little bit, but we shouldn't really have to worry about that too much because they are, reporting data each day, because obviously we're not going to zero on any of these days. But I think we can pretty clearly see an upward trend on these data, and since it's daily new cases, that's of some concern because if daily new cases are on an uptrend, that means that more than one new person is being infected by each current case on a daily basis. So what we're seeing here essentially is cases being reported today that were infected somewhere between, say, there and there, right? Because it takes some time for the infection to gestate and become symptomatic so that people would would get a positive test or have symptoms so prevalent that they would call it a confirmed case. So, not good for the United States. That's a bad sign. So this is also the U.S. and what we're looking at here is the deaths per million people. And this is again also reported on a daily basis. You can see that same variance, the undulation that happens with the data. The good news here is that even though we were seeing daily cases increasing on a trend, we're actually seeing a downward trend in the deaths per million, which is, a good thing. And I think that's probably due to an increased understanding of the therapeutics that work for this disease, the things that are helping a lot of the medical staff to keep the patients alive and get them to the point where their own immune system can finally defeat the virus. Sorry, wrong way. Okay. U.S. death rate, by the way, is about 6% right now. So this is Brazil. And so same timeline, May 22nd to June 20th, 30 data points. And definitely you can see an upward trend with Brazil. Now, it's hard to extrapolate this with that last data point. That line might have been a little bit too steep, I think. But it's of concern. I probably could have drawn that line about there also, which makes a big difference. But, that last data peak. For example, yesterday, Chile in South America just reported a humongous spike in the new cases, maybe triple what it had been the prior day. So sometimes when you look at your data, you get spikes like that are can be a little bit confusing, but you have to take them in stride because it's the data you have. If you start doing things like throwing out your lows and your highs and truncating your data, then it in my opinion doesn't really help to solve problems. But we're definitely still seeing an upward trend still in Brazil in new cases. Brazil's one of the real places of concern in the world because the healthcare there, while they have all the medical advancements that exist in the world, but at a limited capacity. So it's going to be very difficult to bring some of the real high-tech solutions to the people in Brazil. The good news on some of those new therapies that are coming out is that they're widely available and cheap. So we'll see how that goes. So this is a slide that's out of order. I apologize for that. Okay, so this is deaths per million in Brazil. And my take on that is that the trend is pretty much solid on that. So because we see more cases, right, and it's a pretty good trend upward, but deaths are holding pretty steady. What that means to me is that Brazil is also getting better at treatment. So they're saving more people, or they're mitigating early in each case, which helps, like treating the fever and things like that. And that gets proven here in this chart, which shows the case fatality rate for Brazil. And you can see that it's coming down. It was above 6% on May 22nd. And remember, May 22nd isn't the start of this data. It's just, I'm showing the last 30 days. But you can definitely see that we've got a nice downward trend. I don't even need to draw a trend line because it's just a downward trend. It's nearly a straight line. And that's really good news. Part of that is increased testing. So they're getting more into that 80%, or I've heard numbers as broadly varied from 35% to 80% of the population that is unaffected by COVID-19. But they're still getting positive tests. So if they test positive, a person who is in the category of people that doesn't really get affected by the virus other than like some sniffles or a little cough, then obviously the death rate's going to go down and down. And that's good news. Ultimately, what we're hoping to see is that the death rate is a tenth of what we're currently calculating. So we'll see how that pans out as we go forward. So this is the UK, and this is one of the slides that is nice. One of the rules that I use when I'm looking at data like this on a short-term basis, and this is a relatively short term, it's 30 data points. I like to see things like that because they tell me something. When you've got 6 data points that are all going in the same direction, that means that something's working, right? So that means that sometime back here, something happened, and then as the course of the disease came on as far as the infection goes, because there's a time lag that we're looking at, something happened back in that region that created a short-term, very significant downward trend in the cases per million. I can't yet give credence to that, which is only 3 days up and effectively 2 days up in a row. But hopefully what we're going to end up seeing is that we continue on a downward trend as the UK opens up. If they do it intelligently, that we will see that they have put in place things that are going to make it so that, again, the R naught, the number of people infected by each person who has the virus will be less than 1. And that's what we're seeing here. Obviously, the R naught is less than 1 in the UK, according to the data, because they're having fewer new cases, trend line again, fewer new cases day by day over time. Now, if they open up and people decide they don't need to wear masks in crowded public places and stop being concerned about things like that, we're going to see the trend line go up again. This is the UK deaths per million. You can also see that that's on a downward trend, which is nice. It kind of flies all over the place in a way, but that data is going to do that, and you might be seeing a little bit of a weekly trend here as well. But overall, it's good that the deaths per million is going down, and I'm guessing then that what we're going to see is that the death rate is also declining. So this is the death rate for the UK as it currently stands. Horrific, right? I mean, 14% is just ridiculous, and I know that the UK has significant testing going on. So just terrible death rate going on here, and I haven't got a really good explanation for that. I know that the news out of Sweden recently was that effectively in their care homes, they're just giving palliative care. Palliative care is essentially care to comfort a person from a disease, but it's not actually treating them to help them overcome an infection. So in care homes for the elderly in Sweden, they're essentially giving them morphine, which slows respiration, making them comfortable and allowing them to die or survive. It's essentially they're leaving it up to the patient's immunoresponse to defeat this. And in the elderly people, clearly that's a difficult case. Now that's Sweden, and in the UK, I don't know if the same thing is happening, but this high death rate makes me think that something is going on in the care of those that are particularly susceptible to the virus that is not helping. It could also be that they've got a different strain, but I haven't seen anything that indicates that in the coverage of what's going on. So, speaking of Sweden, so this is Sweden's daily new confirmed cases per million. And I can see an upward trend in that. Obviously, that 0 number for today, I'm guessing it just hasn't been reported yet, but we'll to see on that. But so Sweden definitely has an upward trend. Remember, these numbers that I'm showing you, where possible, are cases per million. What Sweden's got 10 million population, so 100 cases, or 100 on this is times 10, it's 1,000 cases. So the number of cases being reported per day are still relatively low for Sweden, but not insignificant. And these are deaths per million people in Sweden. Those are daily, again, reporting, so we're seeing how it goes over time. This varies so broadly, it's really difficult to see anything out of this. I could apply a mean line to it and put some controls in, but I don't think we're necessarily seeing a trend here. We know that the cases are going up, but it doesn't show us much. And then the case fatality rate, this is what we'd like to see, is that the case fatality rate drops over time. Sweden, again, has very good medical care, and I think as all of the medical personnel, the doctors and the researchers across the world are learning more about this virus, they are gaining capacity to treat and keep people alive, and I think that's why we see these numbers dropping over time. And here on these next three slides, I put France, Spain, and Italy together, just because they've kind of come off of the forefront, but I still wanted to present the data. You can see that before June 1st, and there's a note there that says that on May 25th, the methodology changed for reporting this. But essentially, I hate to discount, something like that, but you can definitely see something changed in that section there, right? It really smoothed out in all three countries. So I'm guessing there's something about the European reporting that changed a little bit. These again are daily new cases. You can see that the trend line is pretty close to level. You do see three upticks for France. No, four upticks for France going on there. And you could say that that's starting to be of concern, but again, until it gets to 6 in a row that go upwards, then I have a hard time getting excited about it as a data analyst. But what this means is, as a general trend, Spain, Italy, and France have gotten to a point where they're infecting about as many new people as have the virus on a given day, or in other words, one person is giving it to one person. And not ideal. We'd rather see it going down. But you can't have everything, I guess. So this is deaths per million. And this chart is kind of wonky because something's up with those Spain numbers. But again, you can't pick and choose your data. You just have to present it as it came. The more you manipulate the data, in my opinion, the more it skews. But it does look like the new deaths is trending downward just a little bit. When I looked at this, when I did narrow it and got rid of that big upward spike there from Spain and that one there, when I narrowed it, you can see that there's a little bit of a downward trend, and that's good news as well. And then the case fatality rate is just ridiculous in France. I don't have an explanation for it. Something's different about France that's going on there. Italy's is horrible, but right there in line, it hasn't really changed much, which is kind of interesting because some of the other countries that I've just shown you show a decreasing fatality rate, but Italy stays pretty steady, and Spain's as well is quite steady. Thanks for watching. If you liked this update, please subscribe. I'm going to do my best to be consistent and frequent on my updates. Meanwhile, wash your hands with soap and water wherever you possibly can, and frequently. Use hand sanitizer if you can't get to soap and water. Don't touch your eyes, don't touch your nose, don't touch your mouth. Wear a face covering in public spaces. Ideally a mask that provides a little bit of protection, but covering your face is better than nothing, and tell your friends to do the same. There's a reason why they're having better success in countries where mask wearing in public is not looked at as funny or strange or weird. I think the data bears that out as well. Again, thanks for watching. Stay safe. I'll try to do the same.